name is Mari-Tate Kendrick. I am a Liberty University student. I'll be conducting an interview with my mother, Sherry Kendrick, RN, IBCLC. Thank you. Hello, Sherry. How are you today?
I'm great, thank you.
Very good. This will be a short interview, anywhere from 10 to 20 minutes, and I will be asking you questions about your servant leadership style. These are very generic questions, and you can base them upon it's situations that's happened at your work. Okay? First question I'll ask you is, what do you think you can do in your leadership role to empower others?
Well, I feel like I do that every day. My job as a lactation consultant requires leadership of RNs that are taking care of mothers and babies. I am equipped to precept physicians, nurses, residents of pediatric programs, as well as physician's assistants. I feel like that I do share a lot of vital information as far as providing care for a newborn and the mother.
Thank you very much. What would your definition of a servant leader be?
Well, first of all, a servant leader, I feel like, needs compassion and a passion for what they do. And being a mother-baby nurse for 38 years, I feel that I have that passion to provide that quality of care and see the mother's actual needs, as well as an infant that is struggling with breastfeeding or respiratory efforts, small babies that are premature.
Okay. What would you consider your personal leadership strengths to be?
I would say just knowledge of evidence-based practice. I've been working for the last 4 years as a policy and procedure committee member. I've done lots and lots of research in my field, and I think knowledge base has a lot to do with good quality care as well as passion.
How does that work in a group setting with you as a leader? Tell me about how you perform as a leader within a group setting.
Well, I do have the autonomy to care for my mothers and babies. Physicians do come to me and my co-workers to inquire about information as far as how well the baby is doing at the breast. If they are having a tremendous weight loss, we have the ability to diagnose that situation to find out what is really the root cause.
Right. What role do you allow fellow staff members to play in collaborating on decisions?
Well, that's a really good way of putting it. We do meet every morning with all the caregivers. We call it a huddle, and nurses will provide us a report on the progress of the infant for the last 8 to 12 hours, and then we provide back to them our recommendations.
Okay. Do you allow for staff members to meet their full potential?
Absolutely. We are always updating policies and plans for the staff nurses to follow.
Okay. And how do you accomplish this, pushing other staff members towards their full potential?
Well, we do have a shadowing program. Like I said, each mother-baby nurse has to shadow us for at least 8 hours every year.
Okay. Have you come across any difficulties during that period of shadowing with someone?
Well, yes, from time to time you have a situation that a nurse may be uncomfortable with the care that she's providing, and needs more knowledge base. So at that point, we work one-on-one with that nurse. We also have a skills fair every 3 to 4 months that provides new knowledge for each nurse to gain.
Okay. So tell me about how you handle suggestions and feedback when you are negotiating changes and improvements within your group.
Well, we do have a very large department. There's 18 lactation consultants. I'm not really sure if this is the question you're asking, but if we do have a problem with counseling a mother with a situation that we're not quite sure what to do, we will come together as a group, 2 or 3 of us, and we will research and we will bounce off of each other concerns and questions and come up with a really good plan this way.
All right. Would you describe yourself as a servant leader?
Absolutely.
Elaborate on that for me.
Well, I just feel very confident in my role. I do feel like I have worked hard to gain the knowledge that I need to practice in the practice I am in.
Can you give me a situation that may have occurred in your past that would show you moving as a servant leader?
There's many, but one in particular, a preterm baby coming to me for an outpatient consultation, having lost 10% weight loss at a 36-weeker with very little proof that the infant was transferring milk, very little wets, very little dirties. The infant, after I contacted the physician, the infant was then later admitted for observation with a 3-day hospital stay. And the outcome of that was a healthy baby and being able to transfer milk well from the mother.
Wonderful. I'm going back to your suggestions and feedback that I asked you about earlier. Do you all have a plan to take suggestions and feedback actually from your patients that you have?
We do. We have a nurse that regularly does callbacks to all patients. And she inquires about our lactation services and if there were any concerns, and we do follow up on every one of those concerns.
Wonderful. Is this something that everybody shares as a group?
Well, especially if they're negative comments, we certainly do share as a group, and we determine what we can do to make things different.
Wonderful. Can you tell me about a situation that may have happened where there was some negative feedback from a patient that you all had to collaborate and come to a conclusion about?
Well, the one that sticks out in my mind is a mother that was scheduled for an outpatient visit, and she went to the emergency room the night before, prior to that visit, and the baby had not had a wet in 24 hours of life, and she was absolutely concerned. Went to the ER. The baby's blood work was fine, but there was still a question of milk supply. She did follow up the next day with an outpatient visit, and we determined that she had polycystic ovarian syndrome. And she was 6 days out now, and she was still unable to produce any milk. And I did recognize this as soon as she came in for her assessment and began to inquire, did she have PCOS? She said yes, she did, as well as her mother. She became very upset at that point and was wanting to know why this was not recognized in the hospital when she was a patient. So we did get feedback on that, and we encouraged our LCs to do a much closer assessment of the breast tissue.
Wonderful. Well, thank you so much for all of your time and your tons of knowledge that you've shared with me today. Before we end, if you will just state, yes, I do agree to allow this to be used for Mari-Tate Kendrick school purposes.
I do agree, yes.
Thank you so much.